Moms Every Day, weekdays at 8:55 a.m. is brought to you by the sponsors of momseveryday.com.
There are many common skin conditions which can be present in children, such as eczema, infections like warts, or birthmarks. And Dr. Margaret Kontras Sutton is here from Sutton Ryan Dermatology to talk about diagnosing and treating skin conditions in children. And nice to have you here, Doctor.
Thank you, Tara, and great to be here.
Yeah, and this is a good topic today because I know my son was born with a small congenital nevus, and there are many conditions like that are present at birth, right?
Absolutely. We see a lot of eczema in the pediatric population. This is a very common skin condition. It can present in little babies or it can present in older children, and it's an itchy, red, scaly rash. It can be in many body areas, for example, the face in this little child. It's very treatable. Here's an example of the crook of the arm, and that's a very common place where eczema appears.
Little patches it can be, right? Or it can be a broad
or
range.
larger areas, and it's very itchy and uncomfortable. So there are lots of treatments and creams and so on that we can do.
What do you do? Because will the kids scratch it?
They will, and there's some oral anti-itch preparations we use. We also use creams, and we have a whole program of dry skin care that's helpful.
Okay, and does it go away eventually?
Well, I can't say that you cure it, but you can certainly treat it so that you can get it to go in remission.
And some kids are just more prone to that than others.
Yes, very hereditary.
All right. Well, let's talk about some other conditions that might be present.
Yes, the congenital nevus, as you said that your son had, this happens in 1% of the population, and it is nothing more than a mole present at birth. And it can occur in any part of the body. It can be any size. It can be very small, like your son's was, thankfully, or it can actually be very, very large. And those we generally like to remove surgically if we can easily when the child is older. And many times it's so large that it cannot be removed. And in those cases, we watch it closely. We're looking for any change to suggest that perhaps it's turning into something possibly malignant.
Okay, and some other conditions to watch for?
Well, kids are prone to infections, and impetigo is a common one. Impetigo is a bacterial infection of the skin and would require some kind of antibiotic therapy, either topical or oral. And it's quite contagious. So for some reason, those little kids get all kinds of things that they pass around to each other.
Okay, well, Doctor, we are out of time, but thank you for that advice.
Thank you.
And for more information on children's skin conditions, log on to momseveryday.com, find the health button, and click on the Sutton Ryan Dermatology page.
Moms Every Day, weekdays at 8:55 a.m. is brought to you by the sponsors of momseveryday.com.